Let's review what is metabolic syndrome. It's basically a conglomerate of symptoms where you have glucose intolerance, or you don't have the ability to respond to glucose in your bloodstream properly. Central obesity or truncal obesity, where you're sort of fat in the middle and not on the bottom or the top. And then of course, insulin resistance. There are certain criteria. If you have 3 of the following 5 criteria, which are on the right side of the screen, then you technically have metabolic syndrome. So if you're a man and your waist circumference is more than 40 inches, measured at the belly button, or more than 35 inches if you're a female, that's one criteria. If your blood pressure is more than 130/85, that's another criteria, and I'm pretty sure they're talking about without medication. If your fasting triglyceride levels are more than 150, and the unit is milligrams per deciliter, or if your fasting HDL or high density lipoprotein levels are less than 40 in men and less than 50 in women, and if your fasting glucose is more than 100. If you have any 3 of these criteria, and these are basic things that should be checked when you go get your yearly physical or whatever, and you can obviously measure your own waist circumference, but if you have more than 3 of these, then you have metabolic syndrome, and you're part of that 90 to 93% of Americans, so don't feel like you're alone. It's pretty much everyone.